So it's time to talk about lupus. Have you heard about it before? Have you heard what lupus is? I said earlier that I'd never heard what lupus is until last year, November, and I was shocked exactly what it was. So do stay and let's talk to Dr. Hilda Mantibia-Boy. Good morning. You look stunning.
Thank you, Amifa. You look good.
What is lupus and how common is it? I saw it and I freaked out. I said, wow, man's woes are never ending.
So lupus is a chronic condition, and by chronic, it means that it lasts very long, often a lifetime, and is an inflammatory condition. So it's a condition that is also autoimmune. I'll try and break that down. So you see, the immune system is the part of the body that helps to fight infection. Now, if you have, or diseases, like it helps to fight illnesses and keeps you strong. Now, if you have a condition where your body is having difficulty recognizing the difference between self and harm or other things that are potentially going to cause harm to you and begins to fight itself, then you have an autoimmune condition. So it means that instead of your immune system protecting you, it is now fighting you. So you have a system or a condition where the body is fighting itself.
Wow. What can cause your immune system to want to fight you?
There are many reasons why that could happen. It could be because you are genetically predisposed. Like there are some people who are more prone to having these autoimmune conditions than others. And if you have these genetic predisposition and you have environmental factors which sort of trigger it, then you just go ahead to develop the autoimmune condition. So in this one, for example, we have things like infections being a trigger, smoking in some cases, sunlight in some cases. The usual sunlight that we all see could be a trigger for someone who has the genetic predisposition for the autoimmune condition.
Is this to say that if you have the genetic predisposition and you do not come into contact with any of these causes or factors, you're safe?
No, you could still have it.
You could still have it.
You could still have it. So the genetic predisposition is one major thing, and the environmental factors will contribute to it developing. But it doesn't mean that if you don't have the environmental factors, you can never develop it.
Okay, so I've heard about different types of autoimmune diseases. Or is it a disease or?
Yes, so we just call them autoimmune conditions. Yes, so autoimmune.
Okay. Yeah. At what point would I know that this is lupus?
Okay, so for lupus, we have different, let's say different types under that. We have the SLE, which is the systemic lupus erythematosus, and that is the commonest of the lupus conditions. Then you have the drug-induced lupus, then you have the neonatal lupus, and then you also have the cutaneous lupus. So even babies can have the lupus, but for those ones, after about 6 months, they may get well, and that may be it. And it's for babies who are born to mothers who have SLE, or infants of mothers who have SLE.
Okay.
Yes.
So the drug-induced, that caught my attention. What does that mean?
Yes. So drug-induced means that it was caused by drugs. So it was drugs that you took which sort of caused you to have it, as the environmental exposure that caused you to develop the lupus.
You don't have the predisposed conditions, nothing.
So the genetic predisposition is something that is key. So often there is a genetic predisposition, and those will serve as triggers and cause you to develop it.
Okay, okay. Between men and women, which gender really is very susceptible to this?
It commonly occurs in women, more commonly than men, because estrogen plays a role in the development. So it's commoner in men than in women. In women than in men.
Okay.
Yes.
Again, if a person is diagnosed of lupus and the person, what would you see, or how would you know?
The symptoms are the main things that will point you to look for lupus in a person. And for this, I wish you had some images that you could show.
Okay, so we've been putting some images on the screen.
Okay. It affects the whole body generally. So lupus is multi-organ, multi-systemic, so it affects the whole body generally. Now, you may have hair loss, you may have, in some cases, depression, headaches, feeling weak, the eye, you may have inflammation of the eye or scleritis, eye problems. Some may even eventually go blind. You come down to the chest, the heart can be affected. You could get heart attacks. You could even get strokes. And then you get the skin rash, okay, the skin rash. So typically on the face, you may have what we call the butterfly rash or the malar rash. So it looks like it's around the area where usually women highlight, you know, that area. So the rash looks like a butterfly. So you have one wing here and another wing here.
Why that place particularly?
That's like just the feature. The rash could be on other places, like where you have the cutaneous lupus.
Oh, wow, that's it. You've got it on the screen.
Yes.
Okay.
Yeah, but it's typically around the like above the cheekbone area.
Where you contour.
Yes, so around there you have the butterfly rash occurring there, and the rash could be on other parts of the body aside there, but commonly that is where it occurs.
So if you have lupus, anything at all can happen to you?
Yeah, because it affects the whole body. It affects multi-organs or multiple organs, the kidney, the lungs, the liver could be affected, the bones, the muscle. So it affects every part of the body. The brain, I talked about the strokes, the depression, all that. So it's multi-organ or multi-system in nature. So it affects the whole body, really.
Okay, so we're
fever, weakness, or you easily get tired. All those things may be pointers that you may have something that is going on and affecting your whole system. So you see, multi-system, your whole system. It's not just maybe like my hand is paining me, that's all. No, you may have other things which are a manifestation of something going on in other parts of your body, not just one part of your body. And the systemic symptoms like the fever.
Okay, so we're quite clear on the neonatal one. So for an adult, what is age a factor? Whether or not you have the underlying factors, maybe the genetic conditions, is age also a factor? It's
often seen from around, let's say, 10, 15 years upward. But it can occur at any age, but commonly around those ages. That's when you tend to find it.
It can occur at any age, if I understand. That means that she can be very fine.
Yes.
And one day wake up too.
Yes. Yes.
Okay.
And you may not know that, I mean, you will ever get a condition like that. Many of the people who have had some of these conditions had no idea that maybe somebody in their family could probably have had it sometime. So it just comes, even though there's that genetic predisposition, it just comes.
Okay. Is it something that's curable?
No. Unfortunately, no, but it can be managed. That's what we say. It can be managed. You know, they have flares and then they have remissions. So flares, the periods when they are unwell or the symptoms are aggravated, and then they have periods when they are well. It's chronic, meaning it's lifelong. But when we give them medications, it's better. And it's good to spot some of these symptoms early, make the diagnosis early before organ damage begins, or before like your kidneys start failing, your lungs start giving way, your heart, your brain. So it's important that we make the diagnosis early. Okay, I was just coming to that because listening to you and understanding how the sickness or the illness will present itself, the symptoms, it looks like it can be any other type of illness. And so what can make a doctor want to test for lupus particularly, and that it will not even be too late? The symptoms that I mentioned, the fever, all those things, you see, once you present to hospital, it's easier for us to put 2 and 2 together. Somebody may not even have made anything of that, the rash that I talked about. Yeah. Does the rash come at the early stage of it, or does it? Yes, it's one of the things that will show up. Yes, it's one of the things that will show up at the early stages. Okay. So once we see it, we put the other things that you are going through together, we do the test, we sort of will know that this is what we are dealing with and refer you to the right people to help in the management. Well, walk me through how it's diagnosed. We will, so the clinical, the history taking, for every consultation, the history taking is really important. So the history of the symptoms that we've talked about, the duration of how long it's been going for, then the examination. The examination helps us to find exactly what you have on your body. So we'll examine you for the signs of the illness, and then we'll do the lab tests or the laboratory investigations and put everything together and clinch the diagnosis. Now, once we do that, this falls under rheumatology, or the bigger field of rheumatology. So the rheumatologists are really like important in the management. So we'll often refer to the rheumatologist. So they are the doctors who take care of people with autoimmune conditions. Yes. So they are subspecialists. So there are not so many in Ghana, I must confess. And I actually spoke with Dr. Jifade, who is the head at the Kolebu Teaching Hospital for the rheumatology unit. Yes. So they will help in the management. If you happen to be in one of the districts far away from Accra, an early referral is still important, because then the diagnosis, even clinching a diagnosis, can be confusing. And we don't want people to assume that this is witchcraft or this is somebody doing you know, once things are put together. And if you're a doctor and you are in the peripheries or you are far away and you are struggling to make a diagnosis of any particular condition, you refer to a higher center. And you could do, if you are in a smaller center, you could refer to the district hospital. The district would refer to the regional hospital, and the regional hospital, if they don't have, they could refer to the teaching hospitals, so that the diagnosis can be made and management initiated.
So how soon or how slow does the illness overtake your body? Because I'm looking at the referral stages. This is happening to me, and I live at Mangwase. I'm definitely going to go to the clinic, then to the district office, then maybe to the regional, before I eventually get to Kolebu. I'm looking at the you know, how soon does the illness, you know, overtake your body? Okay,
so I just mentioned that so that people know. But if you are in a smaller center and you find that this condition really difficult, you may not get somebody in the district. You don't necessarily have to pass through all those hospitals before getting to a place where you will find the specialists or subspecialists who will manage the condition. And it depends. There are some who have mild illness and there are some who have severe illness. And I mean, so it's difficult to tell that you know.
Not particularly thinking about the hospital. I'm just concerned about the illness when it gets into your body and not seen quickly. The time frame, it can just overly, you know, destroy you or take your life or anything. But please, you can send in your questions or comment quickly on 0551 575757. I have the phone here. Be kind, don't call the WhatsApp number. But if you want to call, please call us on 0302 211 693 or 94, 0302 211 693 or 94. Lupus, I mean, wow. Yeah, I know how, you know, I freak out about illnesses, Dr. Matibia, but I'm asking, before I go to the lifespan of a person, I just want to know, by the time I'm not too sure, I'm presenting fever, my head is aching me and all of that. Between that time and when I get to the doctor and say, oh, I'm sorry you didn't come, how long usually does it take?
It's variable, and everybody has their own sort of symptomatology or how their condition will go. So it's difficult to tell that maybe 1 week or 2 weeks. So it depends on each individual. But the earlier you come in, the better, so that we have the opportunity to initiate the management before the organs start failing. And that could be variable for each individual. It's not like one fixed, let's say, duration. Maybe I'll say 1 week for this person or 1 year for this person. No, it's variable. But the earlier you seek help, the better, so that your body doesn't fail you.
So is it, I mean, we know that in terms of autoimmune system sicknesses, cancers and all of that, it's always a challenge, the diagnosis.
Yes.
You mentioned how complex and difficult it is, sometimes can be very tricky, but how easy or difficult is it?
Once you know what you're about and you have access,
it's highly dependent on the doctors too.
Yes, on the doctors, like their skill, and then the availability of the labs. So the lab support system, if you have a lab in the facility that you can get those labs done in. If not, you just refer so that the person can have the opportunity of doing those labs wherever they can get them done.
Do you say a person goes on remission if they, with lupus, a person can go on remission? Okay, and a person who doesn't go on remission, I mean, okay, let me say, how do they die? Let me just be, what happens to them? What's the worst that can happen? Yeah.
Yes, so they die. Some will unfortunately not survive, and it could be because they've had infections or they've had a stroke or they've had one other complication or the other. But yes, some die.
So what is the life expectancy? Like if you're eventually, they say you have lupus, expect the worst? How long can you live with it, though it's chronic?
It depends. There are some who will die sometime after. Maybe, let's say, 2 years, a year, 10 years. There are some who will also live much longer, 20 years, 30 years. Yes, so it all depends on the cause of the illness that you have, the severity of the illness that you have, and how the medications are working.
So you said estrogen plays a major role. Is it when it is low or high?
When it is high.
When it is high.
Yes, that's why it's commoner in women than in men.
So when a woman is young, the estrogen is higher.
Yes.
But my friend was only 31.
As for disease, MFA, there are 15-year-olds who have been diagnosed with SLE.
Is it quite common in Ghana? How overwhelmed are you with such cases in Kolebu particularly?
So unfortunately, we don't have any epidemiological studies that have been done, and about 5% of inpatient admissions have been because of lupus or SLE-related conditions. So that is what I know now. And formally, from what Dr. Day says, the deaths about 10 years ago was about 45% of the admissions or the deaths, but now about 20%, 25%. So it's getting better. It's getting better because now we have the people who are helping to manage it, and people are taking the medications, and also the follow-up is also better.
Okay.
Yes.
So if I'm not presenting any symptoms at all, could I just walk to the hospital and say, you know what, I've heard about this illness, lupus. I want to run a test to see if I've got the predispositions or what? Can I?
It's possible, but you see, even in medicine, you don't just like request for labs for requesting sake. And when we talk about screening too, you're talking about people who are at risk, like a population that is at risk. So let me give an example. If I'm not sexually active, why do I go do a pregnancy test? You get, so it's not one of the things that you just walk in and say that you want to screen. But if you have had symptoms, a few, maybe the headaches, the fever, and we especially will do these labs when we are having difficulty diagnosing. Let's say a child is having fever, or even an adult, an older person, you have the fever, you have some of the symptoms, and it's not the commoner ones, then we'll zoom in and add those to the investigations that we do.
Okay, I mean, good one when you said that if you're not having sex, why would you want to test for pregnancy tests or even sexually transmitted diseases? So if I have a mother who's diagnosed of lupus and sadly died, I'm not presenting any symptoms. I don't have a headache, I have 0 symptoms, I still want to test. Are there, do we have facilities?
Oh, we do. We do.
Okay.
We do. But then even with the labs, it will need to be requested by the doctors. So we can request the labs for you to do. But chances are that if you don't have any symptoms, your labs will come out normal.
Okay.
Yeah, so that's the other thing. So sometimes it's also so that you don't waste resources. Because
how affordable or expensive is
the tests are expensive, I must say.
These are genetic tests, right?
So they're not really genetic tests per se, but you'll do basic supportive labs, and then you do the labs that will sort of specifically say that maybe your ANA, dsDNA, like there are some labs that we request to see whether the person has the autoimmune condition or not.
Okay.
Yeah, but it's not cheap, and they are not on the health insurance. Many of them are not on the health insurance, so it's quite expensive.
How did depression find its way to be part of the symptoms?
Because it affects the brain. Yes, because it affects the brain. So multi-organ, the brain is affected, the hair, even hair loss, the skin, the heart, the lungs, the kidneys. So the whole body can be affected by it.
We'll come to the treatment.
Okay.
But let's go to Takoradi and talk to Andy. Hi, Andy. Good morning.
Yeah, good morning.
Thank you for calling.
Yeah, okay. I wanted to know, if you are affected with lupus and, it affects your kidney, and you, go for surgery. You go for surgery, and you change your kidney, and you get a new kidney. Do you, does it affect the new kidney or like?
I see the direction of your question. That's a very good question. Thank you. Okay. Knowing what we know, that there's the genetic, the predisposition factors.
Yes.
All right. If it's been diagnosed and we can see that as one of your kidneys that is affected, and you're lucky to have had a kidney transplant, what happens to the next one in the other organs?
Once it's in the body will try to fight it. And so that kidney will not be like spared because that kidney is sitting in that body and the body's immune system is what is fighting. So what it can probably do is to delay, because it's like a new organ that is in there, but it will delay. But eventually it may be affected as well.
Wow. Wow, for a doctor, what's the hope around this particular illness, lupus?
What's the hope?
Yeah.
The hope is that there's treatment available.
Okay.
Even though it does not provide cure, there's treatment available, there's support available. And Dr. Day's group, the Rheumatology Initiative, they are also doing a wonderful job. There's a support group. If you have any questions or concerns, or you are experiencing some of the symptoms, you can call in, they'll direct you, and you will speak to somebody who can help you to make the diagnosis. And they have a community of people who are affected by these autoimmune conditions, the SLE, and you see some hope for them. They are sharing their experiences, and generally the outlook is better.
Okay.
Even though it is not everyone who will sort of survive, the outlook is still much better now than it was years ago. And that's something to be thankful for.
Okay.
And with all the conditions that we have in the world, I mean, someone will say something must kill a man. I mean, everybody has their own peculiar, and for many of these chronic conditions, the hope really is in the now. And it's in the ability to take care of yourself and get some support, get some treatment while you are still alive.
Okay, let's talk to Kofi Kapito and we'll come back still to the treatments, okay? Hi, Kofi.
Morning, how are you?
Hi, Kofi.
Good morning, how are you?
Good, thanks for asking. I'm well. Please go on.
Yes, I'm very, very excited about the topic.
Okay.
I have a family member who, let me ask the doctor, why does it happen? I've been told that when a woman, especially, has a lot of hormonal change, like when you get pregnant the first time, or when you have a child, some traumatic thing sometimes causes the lupus to react in women. Because my younger sister was fine until she got pregnant.
So sorry.
There was nothing wrong with her and everything. But after the pregnancy, luckily she's been living with it for almost 20-something, almost 20 years.
Good to know.
Yes. The issue is, I'm glad in Ghana that Joy Prime is doing this. A lot of women, especially the results outside shows that lupus is very, very, more black women get lupus than white women.
Right.
And the question is, why? Is it because of our makeup? Is it because of, I don't know why is it so unfair to black women. Because if anything else is for women, I presume that it would have been for all women. But can the doctor tell the causes or the reasons why statistics proves that maybe black women more are affected? Thank you.
Thank you so much, Kofi, and I'm happy to hear that your sister survived it. For 25, that's some hope, really.
Yes.
Yeah, thank you. Please hang on to that, and then we'll go to Koforidia, maybe Koforidia. Let's go to, is it Mency or Nancy? Hi, Nancy. Mency. Yeah. Okay, good morning.
Good morning, dear. How are you?
I'm good, thanks for asking. Please, go on.
Yeah. I didn't join the program from the beginning, but actually it's going. And one question I want to ask is, you see, from what the doctor is saying, treatment is expensive. It's not only
It's not that affordable. The NHI is, yes.
Yeah, sure. National Health Insurance, yeah, I think that's not covered. What I'm interested in here is I want to know the cause, what generates all this, and then what can be done about it? Because, like, if someone like you, excuse me to say, if maybe you should go through that challenge, you might be able to stand it, you understand? Maybe treat yourself. But how much more if it goes down to, you understand, that level of people?
Okay.
And how are they going to treat themselves because of the cost involved from what the doctor is saying now? What is the cost? And I think we should know the cost. What should be done to prevent it? So if they are there treating it, I think they should go to the grounds, as he's talking now, like to the various communities, give more education on that. And I think with that, if it's like what we do to attract it or to get that challenge, if it gets reduced, I think it will be better.
Thank you. Yeah.
I'm so much grateful with the program, with the education that you people are giving out this morning. And we are learning a lot from it.
Thank you. Thank you, Mensi. I think Mensi's got about 3 questions in one. Affordability of it, accessibility of it, and I mean treatment as well. We're going to go into treatment, but says that how the cost. Can you put a figure to it?
It's difficult to just off the top of my head say that like this much or that much or that much, but I know that it's relatively expensive. It's not as affordable as the anti-malarials, let's say 20 cedi or 30 cedi or so. No, it's much more expensive than that. But I'm also happy to say that for some of the patients that we have had, they received support from the foundation, the Rheumatology Initiative. There's a foundation that Dr. Day also has, and they provide some support with the investigations and with the test, with the lab. If I say investigations, it sounds very technical.
like Damper is coming in. Okay.
So with the tests that need to be done and with the treatment in some cases. So there is some hope. And I mean, it's really cool to know that we have people who are standing up for the underprivileged and people who are standing up for people who have rare conditions or not so common conditions and are making a difference in their lives. Kudos, Dr. Jifa Day.
Oh, kudos, Dr. What?
Jifa Day.
Dr. Jifa, good morning.
Day's husband. Kafu Day's
wife. Oh, right. Oh, okay. So if you're experiencing any of these symptoms, so it's called the room chart. Is that it? Yes. So have you had any of the following symptoms for more than 6 weeks? There's a toll-free number. *844 *555 *35. Please take a pen and a paper, or be quick enough to take your phone to take a shot of this one. So fatigue, as doctor said, general unwellness, swelling of joints, unexplained hair and weight loss, tingling in hands and feet, recurring fevers, chest pain and difficulty in breathing, recurring skin rashes on the face and other parts of the body. So it's very free for you to screen for an autoimmune rheumatic condition. It's very, very, very free. So Mensi, if you have a concern about people who cannot afford at least the first step of trying to screen, I hope that you're even able to pass this information to people who will need it. Everything is a little step in the right direction. So hopefully we can get this information to everybody. Be quick and take a shot of it so that you can save somebody out there. Say the shout out again to Dr.
Yes, to Dr. Jifa Day and the rheumatology team at the Kolibu Teaching Hospital.
Okay.
Yeah, they also have some in Komfo-Anokye Teaching Hospital anyway. So there are rheumatologists there and here as well.
That's good to know. Yes. Let's go to the treatment. How does the treatment look like?
So it's a combination. So the medications that are given, first of all, there's also the supportive, the counseling that is done. So we'll say it's like bad news. If you have a chronic condition, it's not good news. So the psychologist will come in and do some counseling together with the doctors after we have sort of talked about the condition to you. So some counseling is done initially. and then the treatment is initiated. So the treatment, something to protect the skin, so like a sunscreen to protect the skin. You know, sunlight is one of the triggers that we mentioned. So you use the sunscreen to protect the skin. And then we have immunosuppressive medications, or medications that will bring down the activity or action of the immune system. So those are a set of medications that are given. Then we have the steroids. And steroids also, or steroids, yeah, I think steroids is the basic thing. I wanted to try and see what other word I can use instead of steroids.
It's like an injection they inject.
So there are medications, tablets that you take. And a common example is prednisolone. I don't know if you've heard of, okay, but it's a steroid. So there are steroids that are given. And these steroids also help to reduce the inflammation. You know, we talked about inflammation. When you have inflammation, there's like swelling, there's fever, there's redness, you know, so the steroids also help to reduce the inflammatory component of the illness, and these are given. But at the same time, these two medications, especially the immunosuppressive medication and the steroids, they also in a way bring the immune system down. And because it brings the immune system down, whoever it is that is on these medications, is at risk of having infections. So infections are a trigger, and the medications can also bring your infections down, your immune system down, and make you prone to infection. So infection is a major problem in people who have these conditions. But this is the management, and then monitoring is done. You know, you are given days that you come to the hospital for the reviews or the follow-ups. And these are really important. Whenever you are giving people a lot of medications to take or asking them to take medications for a long time, there are issues of compliance. People get fed up. God has saved me. God has healed me. My pastor says this, so now I won't take the medications anymore. Some of them will also stop and start using herbal medications because they say, this one, when I sat in the trotro the other day, the man told me that if I take this medicine, it will cure this, it will cure this, it will cure this, when the hospital is saying that they cannot cure it. So then they will stop the hospital medications and go and take the one that the man in the trotro said will cure the condition, and go and take that one. And you know, some of these concoctions that they mix has some roots and herbs and all that, and also has some hospital medications in wrong proportions in some cases. You see, so then kidney problem is an issue in SLE, and you go and take these medications which can affect your liver, can affect your kidney, and then it worsens it. So compliance is a main, like, it's a problem in when people have chronic conditions. And so we encourage and continue to advise that if you have a chronic condition, you need to stick to the medications that you are put on. If you have any concerns with any of them, the best person to talk to is your healthcare provider or the one who gave you the medication. So you have anything that you're experiencing that you're not sure of, just mention it to your doctor when you go on review. And even if it is not your scheduled review date, and you have issues or concerns, you don't feel well, don't stay home. Yes, go back to hospital so that you can be taken care of.
Let's go back to the underlying factors. Remember Kofi Kapito's question about why black men are more susceptible to lupus. And he mentioned about the hormonal changes. You mentioned the estrogen. And so, and for still on that particular case, his younger sister, who was very fine until childbirth and then was diagnosed. Does this mean that she already had it? I mean, genetically, it's an underlying factor was somewhere in the body?
Yes.
Okay, so 3 questions and all.
Yes. So let me see how best I can tackle it. Now with the commoner in the women, yes, it's commoner in women. We've talked about the estrogen, the hormonal factors. It's also commoner in blacks. So it's commoner in the African race, and the Hispanics also have a higher predisposition than the Caucasians. So, and it's not all these things that can be easily explained. So it's not everything in medicine that you can easily say that this is why this is why this. Sometimes studies have been done and these have been found. But it's not all the time that you can say that this is the cause in, let's say, black.
But generally, do black women have higher estrogens than white women?
I'll have to check on that. It's not something that I have come across in my reading.
Okay.
So I have to look at that again and see whether that is an issue.
Okay, so generally women are more susceptible to this, except that the black women, what is it?
So the black women are black, so it's commoner in blacks and it's commoner in women.
Okay,
so
if
if
first
you are
of all, you have
woman,
to, okay, the black before.
Yes.
Wow. Okay.
So that is part of but it's difficult to explain exactly why this occurs. So we have to look at it and then.
So Kofi Kapito's sister, we can conclude that definitely it was hiding somewhere.
Yes.
The triggers was the childbirth because during pregnancy, hormonal changes, is that
hormonal changes are there, and also probably stress could have contributed to it.
So is this possible that if she never had a child?
You see, some of these things,
I know that I bother you a lot.
No. So you may, even if it wasn't the childbirth, something may have brought it on. Because once the genetic predisposition is there, the son is there. You get it. Infections are there. Medications are there. You see, so often the genetic predisposition and then the triggers, and you have it. As to why somebody who has that predisposition has it at an earlier age than another person is also something that we need to look at. But once you have the predisposition, there are triggers, you can have it.
Okay. Let's go to Takwa and talk to Patience. Hi, Patience. Good morning.
Hello, good morning. How are you?
Please, I'm well, thank you. Please go on.
I'm also fine. I'm listening to the program. And you have been putting some number on the screen.
Yes.
How can I get in touch with them?
Okay, keep watching and I'll try and bring that information back. It's a toll-free number for persons who are showing certain
Yes, I'm getting the number.
Okay. So have you taken the number?
Yes.
Okay, so we'll repeat why you would have to call that number. It's not a number you can just call, but if you're showing symptoms like this for 6 weeks, fatigue, you don't feel very well generally, you have your joints are swelling very frequently, and you're losing your hair, you're losing weight as well, you know, some fever and particularly chest pain and difficulty in breathing, and look out for rashes on your skin as well. That's very important. If this is happening a little over 6 weeks, then you can call that toll-free number. Okay, Patience. Okay, so
let me just say again that if you're experiencing these symptoms, you shouldn't sit at home till the 6 weeks. You get, because it could be tuberculosis, it could be cancer, could be anything. The rheumatological bit is also a possibility, but it could be anything. So don't sit at home for 6 weeks and wait till 6 weeks before you call the number to see whether it's a rheumatological condition or not.
Okay. Anyway, so this is an interesting question. It says that this is from Anwar Samson from Subinsu. Says that is lupus communicable or non-communicable? And if communicable, how does one get it from the host? The person who is carrying
it's not communicable.
Even that question I can answer for you. So thank you but that was a very good question, so that you don't start discriminating against people who have been diagnosed.
They already have their stresses from the illness, so you wouldn't want to call them names or make them feel more terrible than they already feel because of probably the symptoms they are having. So let's be kind to each other. And there may be people in your office that you are working with who have the condition and are doing well. You may never know. So just be nice to everyone. Okay,
I've seen a request that we should translate this in Chi. That's going to be tough, but some way, somehow, maybe we'll be able to get doctor to come in another time so that she can be able to say everything in Chi for us. We've said a lot. So there's a question from Togo. I want to ask if I wasn't in position to meet. Okay. Let me see. I wasn't in position to meet up on time, so I want to ask, please, from the symptoms of sickness, I ever had loss of hair of the symptoms, but I'm having loss of hair, and it's been a while. I think that a standalone as a symptoms will be difficult.
Yes, maybe. That as a standalone will be difficult. It may be that you have baldness in your family, and it depends. It's also whether you're a man or a woman. But if there are no other symptoms and that's isolated, just baldness, you may need to look at what is causing it. See your doctor and talk about it, but not likely to be SLE if there's nothing else.
Thank you so much, Chukwuemeka. Your message came all the way from Togo, and I hope that we've been able to help you on that. So just hair loss is not enough. You might want to look out for all the other symptoms that Dr. Hilda Mantebia brought. I'll take your final
If you're a woman, you could also wear a wig. Like
you can also wear a wig, really. Chukwuemeka, you're not a man, but you can wear a wig. Anyway,
but the men are wearing wigs these days.
Nowadays,
so,
everything
and they
is
have
possible.
the patch for the bald area, and then they find a way.
Everything is tricky in this country now. I'll take your final words. Yeah.
So the autoimmune conditions are real, and they can be explained. We should not just attribute them to maybe witchcraft or somebody doing me or other. If you experience any of the symptoms that we have mentioned, see your doctor. If you've seen your doctor, you're not seeing any improvement, get a referral to a higher center so that you can be managed appropriately.
Okay. Thank you so much. I've learned a lot, and definitely I hope that my very good friend is resting in the bosom of the Lord. Tina, I miss you so much, and I promise that definitely we talked about this so that we don't lose a lot more loved ones, okay? Okay, so thank you for joining us today. There's more on the show. Jay comes up, Bits and Bytes this day.